Hi, just Jean talking. I am Jean. I am a registered nurse and a maternal child health and family planning nurse practitioner. And my job here is to demystify some of the systems of the body and let you know how they function in plain English. So, we're at the ball game. It's the top of the ninth. Bases loaded. Score is tied. Strike two. Ball three. Ooh, everything is so exciting. Oh my God, I gotta pee. Ladies, what is the reason why we sometimes have to pee at the most inopportune times? Well, first of all, one reason could be just excess drinking, excess fluids in your body. Once you drink and drink and drink, your body has to get rid of some of that water that it cannot use. So what happens? We go to the bathroom. Normally we go to the bathroom about 8 times a day. And overnight, usually if things are normal, you only have to go maybe once or maybe none overnight. So we could have an overactive bladder. That means that when your bladder fills, a signal goes out. The brain actually sends a message back to the bladder and says it's time to push some of that urine out. Once the bladder gets almost full, ready to be full, it sends a message, and that message comes back from the brain to the bladder saying, push, it's time to get rid of some of the urine. So, sometimes you can take diuretics, and the physician may even order that for you because in conditions such as hypertension, they want to get rid of some of the liquid in the body. So they give you a medication which forces the bladder to let some of that water go. You can also take diuretics on your own by means of like soda, caffeine. Those things are diuretics that you introduce into your body. So when you do use those sort of things, you're going to have excess urine. Urinary tract infection can cause excess voiding. Voiding means urinating, means peeing. So, if you have a urinary tract infection, that means that some sort of bacteria or some sort of harmful agent has entered into the vagina or the urethra and sometimes into the bladder itself and causing you to have an infection. Now, along with the frequent urination, you're also going to have fever, pain, maybe some redness down in that area, symptoms that let you know that this is something different from just a frequent urination. And in that case, you probably do need to see your physician. Cystitis is an illness or disease function where the actual muscles of the bladder become irritated. So if the muscles are irritated, of course, the bladder doesn't have the same force, the same capacity to empty itself as it did without that. This is also a situation where you would have symptoms like fever, untoward symptoms that let you know this is not just a regular from drinking coffee or caffeine. This is something that I possibly need to see my physician about. Sometimes bladder stones can form. Now, in the body, there are natural minerals that are in the body. Sometimes these minerals can get together and form stones or areas that are very hardened. And if this happens, this decreases the bladder's capacity to empty itself. So that's another reason. Another thing that could cause frequent urination, pregnancy. When women are pregnant, of course, they pee all the time. That's because as that uterine body grows with the baby, it's pressing against the bladder and it's taking up some of the space. So therefore, the bladder has to frequently empty itself, it doesn't have the capacity that it normally has because the space is lacking because this uterus is pushing down on it. Stress can cause you to urinate a lot. So the way you eliminate that is you eliminate stress. Keeping yourself feeling good about yourself and looking good, all that kind of stuff. There is a hormone in the female body called estrogen, and that estrogen controls a lot of things in the female body. One of the things that it affects, of course, is the bladder. As we grow older and we have less estrogen being produced in the body, that means that the organs of the body are affected by it and they become less efficient. The bladder becomes thinner. If you think about the bladder like a balloon, like when you first get a new balloon and you blow it up, it's kind of hard to even blow up because it's kind of like thick, and you push and push that air in there, but when it gets blown up, you could touch it, it just kind of bounces right back out. That's kind of how the walls of the bladder are. And then as you get older, just like an old balloon, it gets softer. So you can actually, just kind of like push and mush it together. That's how the bladder is. So if the bladder doesn't have that strong elasticity to it, then it doesn't have the capacity to push that urine out the way it should. It's kind of like just static, and the urine is just kind of laying in there. Let's see, what's the final thing? Okay, there's an actual pelvic floor where all of our female organs are resting against a pelvic floor. This pelvic floor is strong, it is fibrous, and it is able to hold the uterus, the bladder, all these organs in place. As we age, with the decrease in estrogen, there is a loosening or softening or relaxing of the pelvic floor. So many times, even like some of the organs will like kind of prolapse down into the vagina. There are people who've had a prolapsed uterus, where the uterus, the cervix, instead of being up high the way it should be up in the vagina, it actually is so loose it can fall down and actually come down into the vagina. And the physician could actually see that upon exam. They can actually see the cervix right there at the tip of the vagina. So, information you can use. Subscribe, comment, let me know if you're getting what I'm saying. Share, like. Thank you. Help a sister out. Thanks.